Do you think AI will substitute doctors? Well, this is a really hard and interesting question. I'm going to speak in the medium term, like for the next 10 to 15 years, because in the long term, like 50 years from now, it's impossible to tell. Who knows how AI will be 50 years from now if we have generalized artificial intelligence, or maybe if Skynet will have taken over the world and we will be extinct. So, on the medium term, like 10 to 15 years from now, I think that most likely AI will start substituting doctors, usually in giving advice to patients. Because just this week we had like a paper published on Nature Communications, actually it was yesterday, about AI in emergency. And this is probably going to be my next video, so if you want to watch it, maybe stick to the end, and there will probably be some link here for you to watch the next video on AI in emergency. But overall, AI is a software, not a robot, so it cannot perform physical examination or procedures or surgeries on patients. I'm not saying it's impossible to develop an autonomous surgical robot, but that's not what we have currently right now. What we have currently right now is a software, AI, like ChatGPT, for example. So far, AI, or large language models, can interpret data, but they cannot collect data. They cannot examine a patient, for example, and they have a hard time acting upon it. They can order medication, but they can, for example, like perform a paracentesis on the patient. So I think that in the next 10 to 15 years, and that's subject to regulation, of course, so it may vary from one country to the other, we will have AI seizing a lot of control over giving advice to patients and perhaps even prescribing some medications. But I believe that most doctors will be more and more focused on performing physical examinations and performing procedures, which is what we need a robot to do. It's what large language models, a software, is not able to do.